Nasarawa State Government has revealed plans to enroll additional 250,000 poor and vulnerable households into the state health insurance scheme, a move aimed at achieving universal health coverage. Speaking at the launch of the domestic resource mobilization for the adoption of the poor and vulnerable in Lafia, the state capital, Governor Abudullah Sule reaffirmed his administration's unwavering commitment to strengthening the health sector. ADBN's correspondent Mary Ojiji has details.
Governor Abudullah Sule explained that the decision to expand the health insurance scheme stems from the economic challenges and emerging health issues affecting residents across the state. He emphasized that his administration has consistently allocated substantial resources to address the healthcare needs of the poor and vulnerable. However, he called for collective efforts from stakeholders to achieve universal health coverage.
Just recently, we have also released another 500 million naira to the agency as part of the government contribution towards the premium of the state corporate health insurance. Let me reiterate the resolve of this administration to continue to provide quality healthcare services to all our citizens. We shall continue to evolve measures towards involving the standards of healthcare services. Let me state that in spite of the commitment in this direction, government alone cannot continue to provide healthcare needs of all the citizens of the state. It is for this reason that this program is organized in order to solicit for the support of the stakeholders, non-governmental organizations, and other spirited individuals to enable the enrollment of additional 250 poor and vulnerable members of the society who have no access to the healthcare scheme.
State Commissioner for Health, Dr. Gaza Gwamna, commended Governor Sule's dedication to the health sector, noting that his commitment has been instrumental in making the initiative a reality.
No resident of Nasarawa State that cannot afford to pay for his healthcare services will be denied access to quality healthcare services. There is no amount of money or amount of time or any kind of investment that we're going to do to make sure that this particular group of people are not denied access to care. That will be too much.
Honorable Safiano Isa Andaha, Chairman of Akwanga Local Government Council and State Algon Chairman, praised the governor's inclusive and transparent leadership. He pledged to facilitate the enrollment of more beneficiaries across the state's 13 local government areas into the health insurance scheme.
I want to assure you that as Algon body, we continue to partner with Nigeria, we continue to support your policy and program with the bill to ensure. I'm happy, Your Excellency, when all of them admitted before you that indeed Algon have been supportive, and I want to say we continue to support them.
Dr. Yahya Bawa, Executive Secretary of Nasarawa State Health Insurance Agency, NASHIA, highlighted the agency's responsibility to provide quality and affordable health care to citizens. He reported significant progress in registering residents under the scheme.
I assure that the contributory framework is in place to ensure that funds raised through this resource mobilization effort are efficiently applied in facilitating access for the vulnerable people who need it.
In addition to the enrollment initiative, Governor Sule flagged off the distribution of hospital equipment to 4 general hospitals and motorbikes for tuberculosis, leprosy, and disease surveillance officers across the state's local government areas. Mary Ojiji, ADBN News.